Good morning, everybody, and welcome to the Osher Center for Integrative Health Grand Rounds. My name is Peter Wayne, and I serve as the director for the center. Today's Grand Round, to be presented by Dr. Donald Levy, the outgoing and founding medical director of our center, is a very special one for our extended Osher community and also for me personally. As will be obvious from his presentation today, Dr. Levy is much more than just a seasoned and technically skilled physician. He's a unique and a gifted healer. I've come to learn this not only from hearing testimonials from dozens of patients that we've jointly shared, and hospital evaluations that have led him to be consistently voted one of the top doctors in internal medicine in Boston over the past 15 years consistently, but also firsthand, as Don and I, Don was my primary care physician before we both coincidentally took jobs at the Osher Center about 20 years ago. Yeah. So as Don's going to much more eloquently share today than I can, he's much more interested in treating and healing the whole person versus curing isolated symptoms. To borrow a phrase from the whole health movement, he's much more interested in what matters to his patients than what's the matter with them. And drilling even deeper, I think Don's wisdom, his kindness, his humility create what traditional healing systems refer to as a sacred healing space, where suffering is invited to be seen and held. And through deep listening and working collaboratively with his patients are given hope and practical tools to reframe their medical concerns and navigate a journey towards a better health of mind, body, and spirit. Dr. Kowalski, our assistant clinical director for our center, reminded me of a telling quote that Don had on his office wall. If you don't understand a man's silence, you'll never understand his words. So in addition to being a gifted physician healer, Don is also a remarkable leader. Well, that was too many. As founding medical director of our clinic, he helped build a unique interdisciplinary team that he stewarded in a non-hierarchical way, where neurologists, chiropractors, craniosacral, and occupational therapists, among others, were all considered as equal and had equal say in shaping both the care of complex patients that they shared and the therapeutic programs that they developed and delivered. Don also modeled and taught me a lot about honest and direct communication and leadership. As he may share in his talk, one of his favorite books is, and pardon my English, On Bullshit, by Harry Frankfurt. Especially in my early days as research director and over the past 5 years as I've been the overall director, Don would not hesitate to let me know when he disagreed with me or disliked how I handle a situation. I've learned a great deal from his direct, wise, and heart-based style of leadership. And speaking of leadership, Don also played a key role in identifying and recruiting his successor, Dr. Darshan Mehta, who's here today, and we're all very excited about that. While Darshan has some very big sneakers to fill as medical director, and I don't think I've ever seen Don wear shoes, so it's sneakers. Darshan's been part of our Osher community for more than 20 years, has had lots of time to learn from Don, and brings his own rich wisdom and ideas that I know will lead our clinic into its next stages of evolution, growth, and success. Before I share a brief but more traditional Harvard-like biographical summary of Don's career, I want to share some announcements and housekeeping information with you. First, happy birthday to Mr. Osher, who turned 97, coincidentally on 9/7, 3 days ago. That's a good lottery number to play. I know I speak on behalf of our entire community in being grateful for he and Mrs. Osher's generous support, vision, and trust. Still in great health, eating well, exercising daily, goes to the gym every day. He's a poster child for the benefits of integrative health principles. We all wish him continued health and happiness. Shifting to more practical matters, those of you joining in by Zoom, please remain on mute. And as you listen to Dr. Levy's presentation, we encourage you to write questions for him using the Q&A feature in Zoom. Darshan will be collecting these, and together he and I will present them to Don in the discussion that follows the lecture. And for those of you requesting CMEs for today's lecture, simply email us at this address and provide the information listed here. So even though Dr. Levy is not one for formality, I think it's fitting to send him off with a more traditional Harvard academic introduction. So Dr. Levy is a board-certified internist. He started his education as a pre-med major, and after swerving from the normal academic track to work in a health food store for many years, he eventually returned to formal medical training and got his MD from New York Medical College, and then did residency in internal medicine and primary care at Mount Auburn Hospital here in Boston. And some of his colleagues from that era of residency are here and still singing his praises. Dr. Levy served as our medical director for integrative medicine at our clinic at Brigham Women's Hospital since 2003. His career has included practicing in primary care and internal medicine from 1982 to 2007. He worked at the Marino Center for Integrative Health in Cambridge for more than 10 years, where he served as the medical director for a year, and then staff physician and director of integrative medical education. At both the Osher and Marino centers, Dr. Levy has been instrumental in building multidisciplinary teams of practitioners and integrating them into academic, clinical, research, and educational programs. Dr. Levy's talk today is entitled The Art, Power, and Science of Integrative Health. So without further ado, please join me in welcoming Dr. Levy.
I thought we were the same height. I thought he was taller than me. Great start. So I'm going to try to tell you a little bit about the career, how I got from there to here, and why I love integrative medicine, why I think it was a giant step forward for me as a primary care doctor, and throw it in as, it's hard to do that, so there's things like what I had on my wall and in my office, and you'll see for yourself many disclosures. And if you learn three things, these are things that have meant a great deal to me. Curing is not the same as healing. The power of the therapeutic relationship, which is, unfortunately, there's not enough time for it anymore, but it's just basically being seen, and some of the limits of modern Western scientific medicine. This is on my desk, on the wall next to me, and I looked at it every day before patients came in for Maya Angelou. People will forget what you said. People forget what you did. People will never forget how you made them feel. And some of what's to come also, there's a book near my desk too, Kitchen Table Wisdom by Rachel Remen, terrific physician who helps other physicians, now leads mostly with people with cancer and their treatment, and wrote a book that anyone can read. All the chapters are 2 pages, so it's just what she learned around the kitchen table with her family and herself. I'll start with a story from her book. It's Dieter and his cancer therapy. Dieter was a young man who had lymphoma, and he went every week for his chemotherapy, in which his doctor gave him some kind of injection. And then he spoke with the doc. Obviously, the injection was his chemotherapy. He would sit and speak with the doc for 10 or 15 minutes, and he just felt like when you have cancer, you're in your own little world, and no one really gets you. But this doctor did. He loved this doctor, and it was very meaningful to him to just have those 10 or 15 minutes. At some point, he thought, I don't know if the chemo is doing anything. It's not really helping. And he said that to the doctor, who just abruptly said, well, if you refuse chemotherapy, there's nothing more I can do for you. So he chose to continue chemotherapy that he thought was not helping, just to come for the 10 or 15 minutes once a week with this doctor. Just let that sit for a minute as we go on. It brings up everything about curing, healing, the therapeutic relationship. 50 years ago, I was managing a health food store, as Peter mentioned, which was quite an education. It was in Cambridge, right down the street. Harvard professors would stop in, including barefoot hippies, but also Harvard types who had a lot of reasons for buying what they bought, and I always asked them. Big diagnoses then was hypoglycemia, everything. If you had a fight with your spouse, it's because you had hypoglycemia. If you weren't feeling well, it was hypoglycemia. And if it wasn't that, it was your gut, it was dysbiosis. It's not that different today, except today the right word is inflammation. If anything's wrong, it's inflammation. There was juice fasts were very big. We sold a lot of juicers. And most of the other stuff was stuff, what was nice is in the back of the store there was We sold about 20 or 30 books. And in the middle of the day, it got quiet, and I read a book, one book a week at least. That was fascinating to read, sometimes outrageously crazy, but fascinating. And then a troubling experience happened, though. There was an elderly woman who I really liked. And soon, at some point, she wasn't coming in much. She didn't look good. And then she stopped coming in. And just through the grapevine, I heard that she was pretty sick, and she went to see an alternative doctor of some sort near us in Cambridge, who I think was an MD, I'm not sure. And all I learned was some other strange things, like she was on a lot of supplements. She was getting coffee enemas and something else. And the last thing I learned, which was very troubling, and when she didn't show up for a long time, is she had died of colon cancer. And that stuck with me and still does today. Okay. So stuck with me that I'm hitting the button here. It's frozen. Oh, that one. Okay, got it. Another unlikely life-changing event is one of the papers that came in was the Vegetarian Times and her Voice. And in 1975, there was this World Congress of Vegetarianism, which turned out to be a congress of scientists and people from all over the world. Also, Scott Nearing, he was a really interesting guy. He wrote Living Off the Land. He was around 90-something. It was a big book. He learned how, he was trying to tell people to get off the grid. The grid wasn't very big. Your telephone and then your TV, but that was the grid. And he was going to be there, so it sounded interesting, and I went there. And I was shocked to see doctors and professors from all over the world who gave really interesting, the most popular cookbook back then was 10 Talents, which is still out, and Living the Good Life with Scott and his wife Helen were going to give a talk. That was fantastic. But it was really interesting to hear doctors, people at leading clinics in Europe, giving talks that made interesting sense to me. So on the way home from that conference, I'll never forget, I pulled off the road in Maine and said, I'm going to try to be a doctor, and I'm going to get trained. After what happened to that woman, don't mess around. When people get sick, you better know what you're doing. And I also wanted to get straightforward, modern, Western scientific medicine, which I'd read about later. It's put into words a lot of what makes a lot of sense to me now by a terrific historian of medicine. I love this. Modern Western scientific medicine is one healing system among many, yet it has formally, at least, in large measure, broken with the traditional wisdom of the body, and herein lies its strengths and weaknesses. By the way, you never hear that last sentence. Everything is either right or wrong. You're for or against this, so it's either all good or all bad. But what's the weakness? Well, I think simply this, and a strength. The body is seen as a machine, a marvelous machine that may develop a broken part. And the goal of medicine, fix a broken part. And with that philosophy, we have done amazing things in medicine. I still remember when I got my first inhaler. It was hard, a tough one to take because it made you really jittery, but I could get out on the ball field and play again for my asthma. I'm talking to a pulmonologist. So fixing the broken part is a terrific and important part of medicine, and right here is a world-class center to do that. But a question arises in general: do you want your doctor to be more like a mechanic or a gardener? Good health and good gardening. There was this whole person medicine on the right there, and there was gardening, and there's a lot of overlap. Gardeners want to look to seasons, to soil, to prevention, to making a plant more resilient, and a lot of what gardening part of medicine includes is what's on the right and much more. So with that, I also thought as time went on and I was a doctor teaching and taking care of people in primary care, there's a lot of limits to what a mechanic can fix. Any chronic condition, when it becomes really serious or advanced, lung conditions, liver, kidney, cancer, become very difficult for us to fix at that time. But look at Dieter. He wasn't even looking for a fix. He wanted to meet with his doctor. And some of these other ones on there, what's the fix for grief and loss? Post-traumatic experiences that so many people have, not from war or from family issues, for so many reasons, including medical treatments. And what's the fix for human suffering. And most, because we see this a lot in integrative medicine, what if there's no mechanical explanation for your symptoms? MRI is normal, everything's normal, and you're sick as a dog. Long COVID. Most people went through an incredible workup and nothing was wrong, mechanically, that is. Some things are now being discovered as we get more granular about that. But what we do in medicine is we manage these conditions. We've done a great job for a lot of things, like my asthma when I was little. Diabetes, we don't have a cure for diabetes, but when insulin came along, wow, we sure manage people's lives and it goes well. But there's so many things we can't fix, even hard to manage. The other big principle that comes up, two of them, disease is not the same as illness. Disease is what the mechanics fix. They fix the broken part. Illness happens to a person, generally, and it always has a meaning and some impact on that person's life. And getting to that has been my biggest challenge and my biggest interest my whole career. This person is ill. We already know the mechanical diagnosis, but what's going on in their life right now? What can we do to help them heal? Can we enhance their natural ability to heal, which I think is a real thing? Sounds like old 18th century stuff, but there's something real about our innate ability to heal. I've sometimes talked to groups of surgeons and I said, you're all holistic physicians, you know, because when you have the guts to slice somebody open and work in there for an hour and then sew it all up, you have a lot of faith in the body's ability to heal, or you would never do a second surgery. And people, you know, what is that miracle? We heal, we get better. We keep it clean, we take care of it, and it gets better. So illness happens to a person. Here are the questions from a wonderful article I read 50 years ago from Arthur Kleinman in Cambridge. If you want to find out somebody's illness, how do you actually do it? What do you think caused your problem? Why do you think it started when it did? What do you think this illness does to you? How does it work in your body? Everyone has a theory. And God help them after they've consulted Dr. Google. But they still have their own version of it. How severe is your illness? Do you think this is a bad thing? Is this really serious? You're going to die from this? Or is this, nah, I just wanted to check it wasn't blah, blah, blah. And what kind of treatment do you think you need? That is not asked enough. When I was a few years out, I was a young doctor, and we somehow got some feedback. People could write in, and they wrote in, Dr. Levy was terrible, had the worst visit ever. I said, okay. Obviously didn't like me. And I read more about what the problem was, and he'd come in with a cold. And he left and he went to an urgent care center where he got the antibiotic he wanted and he felt better. So I didn't give him an antibiotic. Why didn't I ask him, what do you think you need? And he would have said, I need amoxicillin. And I would have said, let's talk about that for 5 minutes, 3 minutes. Viral illness is probably not a good idea. Why don't we make a plan? If in 2 or 3 days you're getting better and then you get worse, that might be post-viral sinus and blah, blah, blah. Maybe we'll start something then. He was right. I learned a lot. I'm still remembering, as you can see. Negative feedback could go a long way. What kind of treatment when people come in? There are people with back pain when they see our chiropractor. I need an MRI. I will not be satisfied till I get an MRI. And sometimes it's just therapeutic, and doctors know that. So that question needs to get asked, and all of these do, and that to me is the heart of a whole medical career. It also makes it really interesting. Curing is also not the same as healing. This is a subtle one. Curing is, again, the mechanics, eliminating the diseased part. Healing is a process of repairing, renewing, transforming. I don't know the right words. This is copied from an article written about it. Trying to restore a sense of wholeness and well-being. You can heal, but not be cured. And that, I mean by that, I've seen people at the end of their lives, and they're ready. They're ready. They're at some form of peace. They're going to die. They haven't been cured. And there are people that have been cured and are still wounded. Just about everyone with cancer would probably know this. Have you ever heard the word scanxiety? If you have cancer, you almost always have to come back for scans at some point. Or if you have a chest disease, you need a new chest CT. And some people, I remember telling someone something in April, and they said, no, I can't do that next month. That's when I have my scans. They're already anxious about their scan. We can enter that conversation as physicians and help them heal, and also carry with them that kind of anxiety. So I'm jumping to the year 2000. I've been practicing around 20 years now. Asked to give definitions of integrative medicine. From my point of view, it was and is an attitude of mind looking at the whole person, which I thought I was doing as a primary care physician anyway, but it's emphasized. We would rather give a therapeutic lifestyle change, which is stolen from the American Heart Association, TLC. They recommend therapeutic lifestyle changes as their first intervention, although everyone ends up on a statin. But we start there with diet, staying well. But then the fact that we can enhance an innate ability to recover from illness and heal, I would love to have that better studied, because it's not voodoo and it's not mysticism and it's not something so outdated. And then finally, what I've said, I'm shocked. I mean, therapists, psychotherapists know about the power of the therapeutic relationship. It beats all theories. It beats everything. They're the only ones that resonate immediately with that statement, but we as doctors should also. So let's go back to Dieter. Doctor says, he tells his cancer support group, the only other place he feels seen or heard, he doesn't realize, the doctor doesn't realize his love is as important to me as his chemotherapy, but he doesn't know that. And then there's part two, look below. The doctor happens to be a patient of Rachel Lemon, the therapist. And she has been listening to him. He's burned out, depressed, feels like a failure, a tired physician. He says no one cares about him. His paycheck is to support his wife and his kids' tuitions. If I disappeared, he said, as long as someone made rounds, they wouldn't even know I was gone. And she writes, he could not receive his patient's affection and appreciation in part because he could not cure the disease. He had so much to offer, and he missed that completely. Unfortunately, for many reasons, this is happening a lot in medicine. Some of it is time related, that there's just not enough time to get past, okay, here's the stuff we need for cure. We did the scans, we did the medicine. Let's talk about you and how you are being. For example, there's been surveys. What do you worry about? Any of you, if you got ill, really ill, a bad illness, scary illness, most people think, okay, dying is it. That's the main thing I'm worried about. But there's very different things. First thing almost everybody says is, I'm going to be abandoned and I'll be alone. Dieter was about to be abandoned by the therapist. I'm worried about pain and suffering and getting disfigured from whatever is being offered, the chemo, the radiation, the surgery. I'm worried about getting dependent and losing control. That's what human beings feel and say and experience. That's part of the human relationship. We can't cure those. We can share them. We can share our ability to heal. I keep coming back to that because it's what's missing from modern medicine, how to learn it. Somebody gave me this from Ernst Hemingway. The world breaks everyone, but afterward, many are strong at the broken places. And that's been told to me by patients too. This terrible thing they went through also gave them strength. Not to dismiss their suffering, but it gave them a strength. Why don't we explore that? We explore so many numbers and data and so many things, and these to me are the heart of medicine, what to do. We are so overwhelmed with data. I just read a very interesting quote. This physician from Switzerland said, we are just patients and people are being overwhelmed with data. It's confusing to the human mind and this and that. And this was a guy named Cessner somebody in 1550. And he was very upset about the printing press, which has now become wildly popular, and everything we were being bombarded with books and magazines and articles, overwhelmed with data. Boy, if he's back in another life, how can we make people heal or become more whole? Rachel Lemon has a couple of great quotes. It's the wisdom gained from our wounds, from our experiences of suffering that makes us able to heal. I love this one. Expertise cures, but wounded people can best be healed by other wounded people. We're not taught that in med schools. Now sometimes there are groups that talk and share their sadness and their difficulties dealing with a difficult patient. That should be in quotes, a difficult patient. What does that mean? It means it's difficult for me to figure out what to do, and I don't feel good about that, and I don't feel good about myself. It comes out in a group if you discuss it, and then suddenly the difficult patient is just somebody suffering in a way I didn't realize. Maybe I should learn how to explore that. So healing and listening. I guess we're talking about words that sound so trite. She wrote, Rachel Lemon, when we listen, we offer with our attention an opportunity for wholeness. Our listening creates a sanctuary for the homeless parts within the other person. There are homeless parts within each of us. That which has been denied, unloved, devalued by themselves and by others. Listening creates a holy silence. When you listen generously to people, they can hear truth in themselves, often for the first time. I think therapists will tell you that. You know that. Everybody knows that. They talk to a good friend, and they now realize what they were thinking. It doesn't happen until you talk to someone that cares about you and you feel safe with. I think that's the fundamental need to be seen. Why isn't that discussed more in the therapeutic relationship? It's big in our world today. It's been written up constantly that one of the problems in our society is there are groups of people that don't feel seen. And when you don't feel seen and you're not able to partake in whatever the goodies are, the wealth or the status or the power, you get angry. And we have some angry people in our world. And some of them, if we sat and talked to each other, it would be shocking, the fact that somebody on the other team actually sees them. But in therapy and in life, being seen, there's a whole talk. I'd love to. In fact, this book I read, what's the book? How to Know a Person. David Brooks, a really interesting researcher and author. It's sort of a simplified approach, but it's a great topic of a book. How to know another person and feel seen. So here's one. I'm moving along quickly. Good. This one is very interesting to me. The power of being seen. And strangely, I picked this particular scenario, as you can start reading about Gerda Weissman. Some people know about her. She's been around as you can see from this. It was 1945. She was a concentration camp survivor of 6 years. When the day of liberation came, she weighed 68 pounds. I heard this, by the way, on a tape 50 years ago. She was wearing a few rags, no bath in over 3 years. That's a long time. I mean, she was a stick. She was ribs. You couldn't even tell if she was male or female properly. And she watched this man walk over and look at her. And he was the American soldier, Kurt Klein. You can Google her story. It's really interesting to hear her tell it. I think both of them are gone now. But he was obviously in shock going through this. And we talk about difficult and very sick patients. This would be the equivalent of somebody just devastated by their illness, in this case by life. But then here's what she said. The biggest thing was he said something, and I remember she said it, the tape I heard on the radio, he said something fantastic. He had a German accent. She spoke German and English very well, but Gerda said he said something unbelievable in this particular version of it. He said, "May I come in and see the other ladies?" She hadn't heard that word in 6 years. And she realized, oh my God, this is just the beginning. It's like, look at me. People like to get dressed when they have a guest. And a lady? And then she said, he did something fantastic. I want to say one other thing about that lady business they're doing. I had a couple of survivors of the Holocaust, and one who I liked very much, so much so that I tried to schedule it at the end of the day so I could chat with her if she wanted to about things. And she told me about the day of her liberation. It was a very dangerous time in Germany. You didn't just go to some self-help place. It was pretty wild. She saw a mirror and she looked at herself and she said, "I saw a piece of meat with eyes." That's how she saw herself. So you can imagine just the way this woman felt, how many people feel when they're very, very ill. We don't know. They don't say it. They feel like they're dying. They're sick. They're miserable. They're different. So then he did something. What did he do? He held the door and let me go first. That's what a gentleman does for a lady. He said, in that moment, it restored my humanity, my humanness, my dignity, and my freedom. He says it over and over again. I've heard tapes of her. In one moment, a human being looked at another human being, saw her, addressed her as a lady, held the door like a gentleman should, in 1945 especially, and it changed her life. So I thought if there's anything that explains that, it's the beginning of the therapeutic relationship. It's just that. What is it that we can do for each other that is so healing and so important? And I bet other people picked up on her and took care of her medical needs and got her nourishment back, and she gained weight, etc., which she did, all of the above. But what is it about that moment that made it so special. And okay, so where's the science in all this? You know, I'm talking about a lot of soft things, and integrative medicine is more than just, you know, some people say holding hands and talking and healing, and sure. I think the science is an attitude. Scientific people have an attitude in which they look for reasonable, supportive evidence for things they do. As doctors, we have to absolutely check that it's safe, do no harm. We acknowledge that we might be wrong. That's science. Karl Popper, the philosopher of science at the bottom there, that's one of the great quotes. The ability, it's hard to prove a theory forever, but you can falsify it. And that's what most theories, what happens. Eventually someone comes along and bumps it into second place. They have a better explanation for that disease or that condition or that phenomena. But the ability of a theory to be falsified is what qualifies it as scientific. In other words, if you're able to say, I don't know, I'm not sure, but I'm willing to, I'm open to evidence, or any thoughts you have. Maybe my middle school science teacher said it better. On day one, 50% of what I teach you is going to be wrong. And he waited. I heard him do this the following year. I listened. He waits because there's always someone who says, well, why don't you teach us all the right stuff? And he said, because I don't know. I'm trying, but I hope to teach you how to think, so that when something you've learned is right, turns out to be wrong, you know how to handle that and go on and grow from that. Yeah, that's better than all the fancy talk. Here, I remember that. That was around 1960. How long ago was that? I can't remember. You can do the math. Medicine itself is, if you read books about medicine, it's not a science. It's a science using, it's a learned rational science using practice. We draw on science every day, but we have to somehow use it rationally in a practice. Historically, we relied on eminence-based medicine. The eminent person, whoever they were, and there always are big leaders in your field who are the top of the heap, and what they say, that's basically what you do. It's true because the eminent person said so. For example, in Galen in 170 AD was like the doctor to everybody. He was all the textbooks for Galen. Everything was Galen. He was like 3 professors at Harvard together, merged into one big, amazing. And he said, blood is made in the liver and it comes out and then it dissipates, you know, the arteries pulse and then more is made. Okay, so if that theory came out, just looking at someone when they cut themselves and blood pours out, I don't see blood getting remade. You would think at 171 AD, that would have been fully discredited? Fully discredited. Well, it took 14 centuries. This is unbelievable. And I love to say this because I know there are things going on right now that we all believe and we carry along, and we're going to find out they were really, really stupid. Not stupid. They were the best we could do. And it's got to be happening. People were smart back then. How did it go that long? And Harvey just simply figured it out. You'd have to make 65 quarts of blood an hour. How do you do that? And then where do you get it? And it just can't, and it's obviously blood has to circulate, it goes around. And what happened? One of the great doctors of the time, the personal doctor to the King of France and the Queen Mother said, Harvey is very learned, but when he says that blood passes through the lungs, he is going against nature. It just wasn't possible that blood could pass through the lungs. So again, I say these things because they're fascinating to put ourselves, what are we doing today that's going to be seen as so off? One more, Semmelweis, childbed fever. This was really interesting. He was at the Krankenhaus hospital, which is like Mass General Brigham and everything put together in Vienna in 1847. And he saw that there was a difference in postpartum fevers and mortality. And he saw one day a woman on the ground praying, begging the administrator, put me in the midwife's clinic, don't put me in the medical student clinic, which also had the famous professors. And he looked it up and found that the medical student teaching clinic had a 13, sometimes in bad years, 30% mortality rate for having a baby. In the midwife's clinic, it had always been 2%. Probably be less today, but back then they didn't have prenatal ultrasounds and blood pressure checks or anything. They didn't know anything. You walked in, I think I'm gonna have a baby. And they still had only a 2% loss of people's lives in those days. He said, something's going on, right? No one else did. No one else thought about this. And he basically watched what happened. What he discovered is in the medical student clinic, before coming to the women's clinic, they were doing dissections in the cadaver lab. They were cutting, there was pus and blood and junk, and they stunk, and they wiped their hands and went and did checkups. It was so gross. And he said, that's got to be connected. They didn't have the germ theory yet. Pasteur's work wasn't out, but he said something toxic is being transmitted from the lab, obviously. And so he came up with, amazing, you have to use soap, water, scrub with a toothbrush kind of thing, wash hands with a chlorine solution, and when you can no longer smell like the cadaver lab, you could go in, and within a month, the mortality rate dropped to 2%. To me, this is like 6 Nobel Prizes. He saved more hell and suffering for women from 1847 on. It wasn't always accepted, though. Very interesting. Semmelweis, they said it's good. It's really good. But eminent doctors made fun of him. He was different. He was Hungarian. He wasn't a cool Viennese, cool kind of dude that fit in. He finally died, actually. He had became mentally deranged. It's not clear. But in 1891, they figured out, my God, he was amazing, and they honored him. And in 1906, they put up a statue in Budapest. I'm sure that was great for him. So there was one of the greatest. So I'm thinking, what's going on today that we're going to be seeing this? We were so stupid to do that. None of us will be here, not in these terms, hundreds of years. And I guess it's summarized by a great historian. Discoveries in medicine have been made possible only by a never-ending struggle against entrenched error and by an unflagging recognition that the accepted methods and philosophical principles underlying basic research must be constantly revised. So another way to say all this, maybe one of my favorites, is from the third Zen patriarch, who said simply, transmitting teachings all the way back from the Buddha, if you want to know the truth, don't seek after the truth. Just cease to cherish your opinions. We all have opinions about anything. Go out and ask people politically. We have opinions, but we just didn't cherish them, and we're open to, tell me, you have a different opinion? Can we talk? We used to be able to do that. It'll come back. But maybe that says the same thing right there. That would keep us at least aware of some of the things we're doing that are probably not optimal. I looked at it in 2009. If you want to do an evidence-based practice, which I was trained to do, and I was teaching medicine to Harvard students and all, and that's what you do. And in this particular time, the American College of Cardiology and American Heart Association came out with their 2,711 recommendations for the year. And when you looked at the level of evidence, an A would be unbelievable. We have randomized controlled trials that are congruent. We have meta-analyses, makes common sense, terrific, really good evidence. 11%. It's 11%. B level was somewhere in the middle. And level C, which was about half of the recommendations, came from expert opinion, who were analyzing case studies and their own experience. And now they sit on expert panels. Wonderful doctors that know way more than I do. But that's what we rely on. And that was in 2009. So I looked 10 years later in 2019, Journal of American Medical Association, New England Journal, still largely based on expert opinions. Little improvement is seen over the evidence base in time, over time. So the only reason I show this is to say, when people say integrative medicine, you don't have a lot of data, you don't have a lot of evidence. I'd say just give us a level playing field. Come on, if 11% of the time we come up with really good stuff and pretty good stuff, shouldn't that be at least worth considering? I just hear so many people say there's no data for anything, and then people like Peter have been researching stuff that people don't even know about because they don't read those journals. So today, real life healthcare, most of the decisions I and every doctor makes are based on scientific evidence, which is often assessed by experts, expert panels, as you saw. We look to our seniors. My whole career, I had a mentor of one or the other to go to say, I don't know what to do here. Am I missing something? And would always give me some more advice. Historical practice is actually fairly useful in integrative medicine. Ayurvedic medicine has been practiced for a couple of thousand years. You can find some herbs that are just being looked at, but there's 2,000 years of record of what they're used for, their safety, et cetera. Something to at least think about, decent evidence, at least level C. And then, of course, whatever we do, we base it on the uniqueness of a patient. I think we should focus, the future should be, we focus on the science of healing. The science of healing, if there's such a thing. Optimal healing environments, healing spaces, healing treatments is what I'm talking about. Healing intention, healing presence, that's the relationship. All of these things are really part of getting well. And I think in the Samueli Institute, the speaker next month, Wayne Jonas, who wrote much of this, is going to be the next month's Grand Round speaker. So I'm going to listen to that one. I'm not going to retire that far away. But so in summary, I have this and another slide or two. Disease is not the same as illness. You can take that home and think about it. Curing is not the same as healing. Both are important. Good one to think about. Again, hard to define when people ask me, what is healing? It's a story. It's a discussion. Medicine is a learned, rational science using practice. We are all suffering, a bit broken. We want to be seen. Doesn't everybody know? There's one or two people you can think of right now that see you. They really see you. It's like gold to have one or two people in the world that see you. Maybe doctors could just see a little better. We all have an innate ability to heal or become more whole. We need reasonable hope and never underestimate the power of a patient-healer relationship. But there's one last thing I want to talk about on this day. It's an interesting thing. Has anyone heard of the pale blue dot? Pale blue dot's amazing. Carl Sagan was a astronomer, very well known on TV and all, and so people knew about him as a scientist. And he was part of the launch of Voyager 1, which was launched just last week, almost 50 years ago, 47 years ago. It was launched, and its goal was to go to the edge of the solar system, to Jupiter, and then out into forever, interstellar space. And a picture was taken when it was 3.7 billion miles away in February of 1990. It took a lot for him to get them to do this. He had the thing, sending a signal, you could turn the cameras around back this way, which everyone said is not maybe smart. What if we ruin the whole thing? What if the whole satellite falls apart? He said something I'll never forget. He said, there's no scientific benefit to this. I just really want to do it. I really wanted people to see this. So they did it. Now, I don't know if you can see. And Mike, can you see that dot? Is that visible? Okay. So from outer space, that's us. That's the Earth. And it took like 2 days for this information to flow in. And then he and his wife wrote a story about it. I have it on the next slide, but I want to read it to you. It's the last thing I'll read because it's so touching. I took part of it, not all of it. Look again at that dot. That's here. That's home. That's us. On it, everyone you love, everyone you know, everyone you have ever heard of, every human being who ever was, lived out their lives. The aggregate of our joy and suffering, thousands of confident religions, ideologies, economic doctrines, every hunter and forager, every hero and coward, every creator and destroyer of civilization, every king and peasant, every young couple in love, every mother and father, hopeful child, inventor, explorer, every teacher of morals, every corrupt politician, every superstar, every supreme leader, every saint and sinner in a history of our species lived there on a mote of dust suspended in a sunbeam. And this is his last couple of sentences. It's touching too. It's been said that astronomy is a humbling and character-building experience. There is perhaps no better demonstration of the folly of human conceits than this distant image of our tiny world. To me, it underscores our responsibility to deal more kindly with one another and to preserve and cherish the pale blue dot, the only home we've ever known. So I believe in big perspectives. That I couldn't get bigger than that one. That's the part that I just read you. And I would say after 42 years, like astronomy, medicine has been humbling and character building. And it's most of what I've learned from people close to me who I love and from my patients, some of whom that same words are there. It's an amazing experience to try to learn how to be a better, bigger person who can see. We all have plenty of work to do on this. So I'm shocked that like that, as a career went by, I don't know what will come next, but it has been a real privilege to practice medicine, and I particularly think integrative medicine is on the right track. Thank you for listening. Thank you.
I'm sure if it wasn't against the rules, people would have the lighter up for an encore. But thank you. That was everything I imagined it would be and then more. So, thank you for all of what you've done and who you are and especially who you're not. So we have some time. I just want to make sure people in the room know that after this event, there's going to be a reception down the hallway at Carey Hall. There'll be some refreshments, and that's a good place if you want to share some stories or comments or words of praise for Dawn. Maybe we
Only
can.
words of praise?
Yeah,
Sounds good.
just today.
I'll
But in here and also through the information that Darshan's curating, we have some time for asking questions about sort of the content of this talk, which is quite broad. So maybe I can start there with Dawn's old colleague. And we have a roving mic here, so please use the microphone. Thank you.
Oh, okay. Hi, I'm Leslie Fenn, and you may recall that I was a senior
Oh, my
resident.
God. My resident when I was an intern.
Yes, when you were an intern and very much a star
Oh,
at the time.
I didn't feel it.
And I guess the question I have is, who would you like to honor from your early life that taught you to be so smart about listening, about being a very fine physician, and knowing the things that you brought to the stage even by then? Because I know many must have contributed.
Oh, my God. I think first my dad was particularly a wise, calm, decent person who could see people of all sorts and types. And then it was different experiences, failures, mistakes. Recently, my family, some of whom are here, my wife, my kids, learned a lot from them. Now I'm learning from my grandchildren, a lot to learn right there. But I don't know, where do we come from? It's really hard to know. I really think our wounds and our mistakes are a place we can learn. I don't like the arrogant doctor that I'm the expert and you're not. I don't think that's very healing and very helpful unless you just need a mechanical fix, in which case you show up, you get it done, you get your tooth pulled and you get out of there and talk to someone else. But I don't know. You were a terrific resident. I remember you. When you're an intern, you feel like there's no chance I'm ever going to be a good doctor, because for every good thing you do, there's 9 things you don't understand. And someone you just almost killed, or you think you did, but
I definitely saw you.
you did.
Then.
Thank you.
And we have a question from the virtual audience from Rob Graham, who you may remember.
Yeah.
Rob asks, Don, do you think medicine can be cured? Today's medicine is fast and volume driven, but you know health takes time. There is also an over-reliance on data and testing. Can medicine be healed while the powers and payers are sustained by volume, not value?
That's the part. I think medicine can be healed. I think as it gets uncomfortable and unkind and something a lot like primary care, I was one of the first primary care internal medicine residents. It was a great field to go into, and now it's that you can't get an internist. Try to find a primary care doc. The specialists can feel like really good mechanics at least, but again, that's not enough. But at least they can feel more content. I think it's just going to have to be when enough people are saying, I need to do it. This is what I need in my training. I can't work the way they did. Maybe artificial intelligence kinds of things will help do the mechanical stuff, get it out of the way, so we have time to be with people as people. That would be a great use of technology. I don't know how that would work. Rob, if I had the answer to that, man, that would be incredible.
Any questions inside here?
I shut everybody up.
I'm sure there's plenty others out there.
Don, well, I guess I'm going to ask another question from the audience. In terms of what do you think is the future for integrative health, as you see for the Osher clinical center here?
I think there's two things. One is there is research going on, and I think it should be along the lines of the science of healing that brought some of those categories. The other thing is, I think the clinic itself, if I owned the building, I try to put people in various specialties that have at least a leaning towards and an openness towards what we do. They don't have to be on the Osher staff. They can still do their specialty. But if we're surrounded by that, and they had to meet at least monthly and not talk business, just talk about people and how they're doing, and teach each other, because that's how we worked in the clinic. We sat around the table and talked, and we had some quite disagreements when the acupuncturist said the chi is blocked in the liver, and someone else said, well, I don't care. The liver tests are fine. They need that. Well, we have to duke that out and start talking a language that's acceptable to all of us. So surrounding ourselves, co-locating and collaborating with like-minded specialists. So I'd love 850 Boylston Street to be a building filled with people that are, anyone coming in would know, oh, you want me to go down the hall to that pulmonologist, to that GI? I know they'll resonate a little, and maybe you'll even read their note. I know they're all in there, the notes. That's supposed to be great, but tell me how many people get to really read them other than the last 3 lines where this is what I said to do. So.
And one final question from the audience. This is from Rebecca Wells.
These are all fellows.
Yeah. It's like, Don, so exciting to hear details of your journey. You have been an inspiration to me. What are your thoughts on the growth and overlap of lifestyle medicine and narrative medicine with integrative medicine?
I think the narrative medicine, lifestyle medicine is important. I think it's like so many things becomes a gimmick. There's wellness clinics and well-being stuff that sometimes the people doing them, I don't feel seen, or I meet the people and I think I wouldn't probably go to this person. So I like the idea. I think it fits into integrative medicine. But just the title alone is a little gimmicky and can be misleading. I mean, lifestyle medicine could be join our gym and we'll show you what to do. And oh yeah, there's a booth over there. You'll pay for some nutritional advice, and over there, there's something else. And it's all supposed to add up to a whole well-being, and I'm not sure it does. I'd rather have one person just see me, and know me, and then we'll figure out what to do next. So I love those people to co-locate along with the other specialists. That's how I would do it. I'm not in charge.
I have one more question for you. Are there thoughts or suggestions you have about how new physicians are being trained that could be shaped by some of the goals that you're talking about? Are there differences that we can do in medical education that would make our graduates closer to your way of thinking?
It's funny, I started my career, I worked here, I was at Mount Auburn, I worked with Bev Wu here at the Brigham on the patient-doctor relationship course, and that was considered a little soft. But one day, it struck me that the medical students came in, they just come from a Nobel Prize-winning liver specialist giving them a talk about something to do with the liver. And it hit me to say, because the kids love, the Harvard students love to do stuff like this, I'd say, what do you think the half-life of that knowledge is? Like before it gets replaced by another liver specialist in 5-10 years, the next Nobel winner. So they took that on. They said, well, some 7 years, this year. And I said, and they debated it a little. And I said, what about the half-life of what we're talking about here? How to see a person, how to ask about difficult subjects, how to deal with someone who might be dying or afraid of dying, and all the things we do in the patient-doctor relationship. And nobody answered. I said, I'll make a guess, 100,000 years? Because I said to them, as long as there are people here who are ill and people here that are treating the illness, whatever we have, there's going to be a relationship. I think that should get studied. And I think somehow we have to tell students that this is as important as any other course you're taking. It's really hard to sell that or tell them, but it's just got to be done. If enough doctors believed it, they'd listen. So, okay. Thank you.
Could I have the slides back, please? Just a few outgoing comments. Again, for those of you who want to join us, Carey Hall, if you go out the door and walk all the way to the end of what's called the Pike, you'll run right into it, and there'll be some refreshments and opportunity. But I have a couple announcements. I hope you'll just stick around for just 2 minutes. There we go. Great. So as Don mentioned, and actually had a number of slides, we have a really special event next month. It's also at a different time of the day than our usual grand rounds, but Dr. Wayne Jonas is going to be coming and talking about cancer in the context of whole person health. Dr. Jonas was the person who founded the predecessor to the National Center for Complementary and Integrative Health at the National Institutes of Health. So he's a real visionary and an incredible physician and thinker in this field of medicine. So we're very lucky to have him. And this is also going to be what we call the Kogan. It's an endowed lecture in honor of Mr. Kogan. So really special event. We also have a conference, a virtual conference that's being held by our network of Osher centers called the Osher Collaborative. This is going to be virtual, it's online, and it's about the links between personal health and planetary health. And we all know that the air we breathe is the same air that's out there, the water we drink, etc. And we're learning about some very rich connections, including how institutions like hospitals can contribute to reducing carbon emissions and things like that. So lots of rich discussion there. We have a really exciting our biannual network forum. This one's going to take place on December 9th and 10th across the quad at the Martin Center at the Harvard Medical School. This also is free admission, but you need to register in advance. And the topic is high-tech medicine and soft-touch healing, and about the dialectics between how wearable sensors, AI, et cetera, as Don is saying, might give us some insight into the biological basis and the psychosocial basis of integrated medicine, but also conversely, how the questions we're asking about whole people and maybe even provocative things like bioelectricity and energy fields can drive the evolution of technology. So very interesting yin-yang bringing together. We have speakers from NIH and renowned speakers from all around the world. So please come take advantage of that. As you know, every year we give small grants away up to $50,000. And so our request for applications is open. We hope that you'll apply. And later in our Grand Round series, you'll be able to hear some of the presentations from recipients of this award. We've given over $1.3 million away to date, and we're really excited about this project. And its goal is to advance evidence and bring people together that haven't collaborated before around the themes of integrated medicine. And finally, we'd love to hear your feedback. Let us know what you think. Register for events. All of these events, or most of them, are recorded, so you can almost go to medical school, just going through our archives and listening to lectures like Don's and many others. Many of our conferences in entirety are there, so you can attend conferences you may have missed in the past. There's also opportunities there, of course, to make donations if you want to support the activities that you're taking advantage of. So thank you all. First of all, especially Don, my dear friend, colleague, and I wish you all the best in your retirement. Really excited to keep walking with you and taking hikes and hearing where your thoughts are going and how you're going to enjoy the rest of your life in addition to your grandchildren and family. So we wish you the best. Thank you all for being here. Thank you all online for joining in virtually, and we hope to see you again soon. And please join us down the hall if you can.